welcome to Island Connections. I am Brahim Aoude, your host this evening. And tonight's topic is homelessness on the rise. And to discuss this topic, we have three guests, and they are Laura Thielen. She is with the Healthcare for the Homeless, and she's the project director. And we have Margot Shrire from Institute for Homelessness, IHS, and she is PR and volunteer manager. And Akwan Makarath, previous member of the Board of Regents, University of Hawaii, Manoa, and also a long-time labor activist. Welcome to the show, all. Before we start, maybe, Laura, if you could give us some idea as to what you do and how long you've been with the project for Healthcare for the Homeless.
Sure. Thank you so much for inviting me. I'm the project coordinator of Healthcare for the Homeless project, and that's part of Kalihi Palama Health Center. And we provide services to individuals who are homeless throughout the island of Oahu. We have 6 different clinics that provide services, and we have outreach workers that work across the island.
Mm-hmm. Yeah, and Margot, would you like to tell us what you do at the Institute for the Homeless?
Sure. My name's Margot Shrire. I'm with IHS, and that's the Institute for Human Services. And we offer safe shelter for people, men and women, and families. We have about 23 families staying with us at the moment, as well as a range of support services designed to really help the folks we're serving make healthy changes in their lives and get whatever support they need and appropriate referrals. So we'll probably be going into that a little bit more later in the show.
Yeah. And AQ, would you like to tell us what's your connection with homelessness and other things?
Well, my connection arises out of long-term social work position with the ILWU, the International Longshore and Warehouse Union, and the fact that I helped to co-found the Committee on Welfare Concerns in the late 1980s and worked with many, many individuals who were receiving public assistance and some of whom became homeless during the process. And I continue to keep an interest in it simply because I can see the connection between homelessness and an individual who might not be able to make enough money, and usually on an unorganized job, to pay the high rents or to buy a home.
Good. We now go to a video clip from the Healthcare for the Homeless clinic, and I interviewed Lisa Abbott, and she tells us, some kind of myths about the homeless and how people happen to become homeless.
All homeless people are individuals, and they have different extenuating circumstances, and usually it's several circumstances that brought them to this place. I mean, I know people who have gotten into accidents, car accidents, had to go to the hospital, had to go into rehab, lost their job, then lost their housing, and all of a sudden they're here. And they're so depressed, maybe they're addicted to prescription drugs because of the accident, and it just gets to be this big, kind of situation that is really kind of complex to get out of. It's not simple. It might mean job retraining, and being homeless has its own set of duties and things that you have to accomplish day to day. Getting food is one of them.
Yeah, I'd like to, before we discuss things, just remind our viewers that this is a live show, and we welcome your comments and questions on Oahu 956-5670, Neighbor Islands 1-800-342-7949. So just our viewers would like to hear from you. Thank you. So, that's Lisa is from your clinic or from your project. And so she started to, say something about how homeless how people get to be homeless and that they are individuals. So could you add more to that, perhaps, and tell us some of your experiences with some people whom you have talked with and helped?
Yeah, I actually started out with this project as an outreach worker. So I think I'm very lucky in the fact that I was able to go out in the streets and really work with people one-on-one. And we have really found that there's not a plan that fits the entire population, that we really have to look at everyone as an individual. What we have found is that a lot of our folks who we provide services to have incredible backgrounds, and due to mental illnesses, due to medical issues, due to a lot of different things, including substance abuse, they've lost connection with their former lives. And we've got wonderful artists, we've got some lawyers that we provide services to. So they have an enormous amount of history, and we need to really focus on them as an individual and bring out those great qualities that each individual has. And I found that that's the best way to help them help themselves, is to bring out their great qualities and let them show that to the world.
Yeah. Margot, would you like to say more about your experiences in regard to Institute for Human Services?
Yes, I'm really glad to hear us addressing each person who becomes homeless as an individual, because as Laura said, every single person who comes to IHS, who comes to some of the other places on the island for support, each person has a different story, and it is complex. It's very easy for people on the outside, and even for people working with people who are homeless, just, first off think, okay, this is the solution. But as Laura said, each person has such a complicated history as to what contributed to the situation. And that's really where IHS is focusing a lot of our attention at the moment. We have various case management teams that are designed to help specific populations with specific problems. So we have an intensive case management team who are working with the chronically homeless individuals, people who have very complicated situations that they're trying to navigate through, people with severe mental illnesses or physical disabilities, co-occurring substance abuse issues. And it takes very specially trained case management teams to help these people. A lot of these people are very resistant at first. They're very careful. They've had a lot of bad experiences with authorities. And it takes a very special rapport from case managers to be able to offer the services in a way that people will be able to be accessible and be open to receiving them. So that's what we're really doing. We have case managers working with the families, case managers working with the men. We have partnering agencies on site offering a range of programs for the people. So we have Salvation Army, Veterans Administration. About 30% of our guests are former military and veterans. So we found that working with the VA has been very helpful. So again, everyone has a very complex story, and we need to do what we can to help people tackle things on a range of areas.
Yeah, so within the homeless population, in fact, there are subpopulations, different subpopulations as well, like as you said, veterans and so on, yeah. AQ, okay, homeless, each person is an individual, and they have their own problems and needs and so on. But could you give us an overarching view in terms of why is it now that we see more homelessness than, shall we say, 40 years back?
Yeah, well, I think, first of all, we need to, as has been attempted by the two women with us this evening and newspaper stories which have been written recently, we need to identify who the homeless are. It's interesting that 25% of those who are supposedly homeless hold jobs, but they don't make enough money to pay rents or to buy a home. We have the disabled, which has been alluded to by one of our speakers, who are homeless. They cannot get enough health care, cannot get enough social services, cannot get all of the supports that they need to find a home, stay in a home. 3, we have those who are addicted, the substance abusers, and as you know, the newspapers have been full of individuals who are addicted to ice. We have those who have been domestically violated, whether they were men or women or children, who lose their homes because of that, and they constitute another group of individuals who are homeless. And then we have those who are unemployed, Let's face it, even though Hawaii has an unemployment rate, I think now of 4.2% as compared to the mainland, which is about 6.1, there are still individuals who are unemployed because they are unable to match whatever skills they have to the demands of a job. Then the other group that we have is a very large population in prisons. As you know, we do not have enough so-called room for people in prisons. We send them on the mainland. That separates families in the most devastating fashion. And then, because we primarily have been interested in the 3 strikes and you're out program, many of our people, for example, who have just a small grain, let's say, of heroin, are immediately sent to jail, even though the present administration has said that we will, in fact, try to rehabilitate them, but not in a prison cell. So all of these things constitute the reasons why we have homeless in the state of Hawaii, even though we don't know how many there are. I rather suspect that there may have been some individuals who have been homeless for so long that they rather prefer the life outside. I also think that we are having quite a different population of the so-called addicted and disabled. Contrary to those who were discharged in the 1960s from the state mental hospitals, we now have those who are addicted to heroin or to ice or to some other kind of drug, whether it was to manage pain in the beginning. So that it behooves the community to provide the kinds of services which it did not provide when we deinstitutionalized the so-called snake pits. And that, of course, makes for many, many more problems, because what it calls for are a different type of social worker. We call them psychiatric social workers, but I believe that the nature of the political economy has changed so rapidly that psychiatric social workers per se are not all the answers. What we need is, for example, individuals who work at jobs that pay more than just $6.25 per hour, which is now the minimum wage. We need to move towards the concept of a living wage, which the American Friends Service Committee did a lot of study on. For example, when you say that people on the island of Maui need to be paid $22.48 an hour, employers are horrified. Who's going to pay a worker $22.48? But it is the cost of living, high rents, high cost of buying a home, high cost of gasoline, high cost of food, high cost of services all over the place, which, for example, makes sense. With the concept of a living wage. It costs less in some other areas, but if legislation were tied in with the idea of a living wage, then perhaps we would not have as many homeless as we now do. I think one of the other problems, since you're asking me to give a conceptual framework of the homeless thing, is the fact that most public housing projects are reaching their maximum age, which is 20 years, and they renovate the projects, they cut out the number of available public housing homes for individuals. Kokua Kalihi Valley, for example, looks beautiful on the outside, but because they did the renovation, they got rid of a number of units, and we wonder what happened to those families. So, seems to me one of the kinds of things that we need to do is to be sure that public housing is being built, and it is not being built at all.
I wonder why.
Well, neither under the Clinton administration nor under the Bush administration have we devoted the kinds of monies to public housing, and we are working under the delusion that Americans should all own homes. which is not the kind of social policy that we should be working under. There are lots of people who don't want to buy homes. There are lots of people who would prefer to rent homes because they change jobs from one community to another. Home ownership isn't all it's cut out to be. You've got to pay the mortgage, you've got to pay insurance, you've got to pay all of the maintenance, and you've got to be sure that you can move into a home where you're welcome. I mean, we're all, as social workers, understand the redlining thing that's been going on. Section 8 is another thing. When you have fewer rental units, the rentals on Section 8 subsidized housing generally goes up. And the city and county of Hawaii, of Honolulu, has not been able to keep up with all of the increase in rents that have occurred, and therefore Section 8 becomes a non-entity. There are no sanctions, for example, on greedy landlords. They will take what the market will bear. There are not enough shelters. IHS, you're filled to the gills, right, with people who need housing. And even lots of the other shelters have been filled to the gills. No money for high rents, not enough rental units. And it seems to me that as a matter of social policy, we've got to do something about that. And we talk about possible solutions.
Yeah, so we can deal with that in a bit. I mean,
exactly.
Or is it possible within this political economy to have solutions, and what kind of solutions, and so on. But in the midst of this chaos, from what emerges from your thesis, is that I interviewed Rec Navarro from your project, and he's trying, and your project is trying to do as much as possible in terms of services to the homeless. So we will watch that interview.
We're one clinic of 4 that's Healthcare for the Homeless Project, and we're under the Kalihi Palama Health Center, which is located on King Street. We service roughly weekly about 100, 150 clients that comes here for their psychiatric appointments or medical appointments. We serve those with those who are uninsured and low income. And our purpose is to reach out to those that are in the community and get them in a clinic. So that's the purpose of our 1 hour clinic. We also help out the IHS shelters. We're linked with IHS to help them, as well as another clinic on the men's shelter side.
Yeah, I mean, here there's like thousands of homeless who need health care, whether it is like for the body itself or for the mind and so on. And you valiantly try to do these kinds of things, but you are one organization trying to do so. So is there, and I know there's like a relationship between you and IHS because you have clinics in the men's shelter, women's shelter also. So are there other kinds of organizations that you try to work with so that you can have like a synergy in terms of your efforts and so on?
We will work with anyone. That's kind of our policy. What we do have in effect right now is an organization called Partners in Care. And that group is a voluntary group of all the service providers or everybody who wants to be involved who provide services to homeless. And so it's a very broad organization. We have faith-based programs. We have contracted with, we've got programs that are contracted with the city, the state, and the federal government. And we also have community members who are welcome to our group. And we meet monthly. Oh, we also have government agencies involved as well, so that there's a coordination of services with them as well. We meet monthly and really look at the current issues of what's going on regarding homelessness. We look at the funding sources. We look at the long-term plans of what to do in the future. We don't want to deal with just the here and now. I think everyone's tired of the Band-Aid that has been put on homeless issues for so many years. We no longer want to just band-aid the issues. We want to end homelessness. And we do really feel that it is possible. But it's going to take a lot of work, and it's going to take the entire community, not just the advocates, not just the community, not just the police or the homeless individuals themselves. It has to be a combination of everybody. And we're really moving towards supporting permanent supportive housing. We really think that that is one of the key elements to ending homelessness. AQ, you mentioned about how Section 8, right now Section 8, my last report is that their wait list is at least 5 years long. That's ridiculous. By the time somebody at the end of the list gets called up for a voucher, they're so far gone, or they're not available to return a phone call, they get put to the bottom of the list again, or don't get called at all after that. With Section 8, we're also seeing that there has to be a 95% occupancy rate with the vouchers statewide. If we don't use 95% of our vouchers, the following year we lose more and more vouchers. And that's a significant problem. Our Section 8 vouchers are decreasing, and yet our numbers that need them is increasing. And it's mostly due to the high rents and the inability of landlords to open up to this population.
Yeah.
And so one of the things that we're really looking at, IHS and our program, we both have Shelter Plus Care programs, which is a HUD-funded program. And it's very similar to Section 8 in that a person pays approximately 1/3 of their income towards rent. Our program subsidizes the rest. So it's like Section 8 in that regard. But we add another component. We have a case manager working with that person consistently, and we have found that that is extremely successful in keeping people housed, which in turn decreases the amount of money that is spent on an individual when they're out on the streets, namely emergency rooms, emergency shelters, jails and prisons. Jails and prisons have, in effect, become emergency shelters for many people, and we need to really look at the discharge planning so that when people are ready to come out of prisons and jails, they're not going to IHS, they're not going to the streets, they're going into some kind of housing. Because bottom line, we can save money if we keep people in housing.
Yeah. Like Margot, also like IHS, you rely on donations, you rely on what other kinds of monies you rely on?
Well, we're relying on money from everywhere. A large part of our budget does come from individuals in the community. We get tremendous support from faith-based community, from individuals. We get state funding as well. And federal funding.
So, and every year you have to go and try and get more state funding, and you have like to please everybody at the Capitol to be able to get that fund. I guess, yeah.
Yeah. I mean, grants have stipulations that you need to comply with, and so our programs definitely need to be monitored and making sure that we are doing what we say we're doing to our funders.
Well, and also for a program such as IHS that's so it's focused on getting donations from the community. When certain events happen in the community, like 9/11, you can see either an upsurge of donations or a depletion of donations. And so that's really scary for a lot of programs that are based on donation. It depends on the economy, how the economy is doing, how people are feeling. And so that puts a lot of stress on the programs such as IHS who rely on donations.
Yeah.
And I must just add that this year we actually are really struggling because we had it's between $100,000 and $200,000 shortfall because of the funding cutbacks on the state level. So that's been very challenging. We have been doing what we can in terms of our appeals to individuals. That's why it's so wonderful for opportunities like this where we can really let people know who we are serving and how important these types of agencies are to the community so that people understand and they're more inclined to become involved.
Yeah.
Well, one of the sad things about this whole thing is that in our drive for world hegemony, we have forgotten that there are people who need to be taken care of. Apropos of what you've said, collaboration among agencies in order to see that we have more public housing. Actually, we should, as a matter of social policy. We know there aren't enough housing units in the state of Hawaii, and we should also work in a fair program of rent control. We had rent control during the war years. I remember working on it with the city and county of Honolulu. Certain parts of New York still have rent control. And it seems to me that one of the kinds of things that we should be so bold as to advocate for are more units with rent control. Just as, for example, we debunk home ownership as not being the end-all and the be-all of human existence. And as far as your prison population is concerned, one of the things that can be done, and which I tried to do with the Career Education Advisory Committee, is to see, since we have the highest number of people in the world incarcerated in the United States, that we, in fact, increase the allocations to the prison population for retraining under the Perkins Act. Right now, it's 1%, and I think our state prison gets something like, I forget what the last figure was, $150,000, which is peanuts. How in the world are you going to retrain people so that you can get them to go on out, get a job that's permanent, and find a house that they can rent? So the collaboration among agencies can be towards any number of kinds of things to take the heat off that is now applied by our legislature and our judicial system on people who just can't quite make it.
Yeah. In fact, you folks talked about Section 8, and I interviewed Mr. Suda. He's at IHS, so we can watch what he said briefly.
My name is Shirosuke Suda. I've been here about almost more than 1 month here. I used to stay in the Section 8. Then I missed my... they give me 2 months to look for a house, then I cannot find it.
You couldn't find it.
Then now I'm on the waiting list again. And they advised me that in order for me to go up from the bottom, I have to stay in this homeless. Yeah.
So here's a live example about, Section 8. And I know like a number of Section 8 are about to elapse, right? Yeah, and then what you're going to do, some of them might be renewed, others might not. But the fact, as you said, like a number of landlords wouldn't want Section 8 people, and they like to take as much as the market will bear, And so here there's a problem. The other problem I find is that there have been a number of, news stories in the newspapers about homelessness of late, And then here homeless people have increased, in all categories probably, and then the money has shrunk in terms of servicing the homeless. So that vision of having a home or a place to stay permanently for everyone, that kind of funding would not be able to realize that kind of vision. So would you like to speak to that, perhaps?
Yeah, I'd just like to go back to the Shelter Plus Care program, to the
Yeah.
permanent supportive housing, because this is really the long-term solution to chronic homelessness. And as Laura was explaining, it's a program where you have people placed in permanent housing, independent living. People are out in housing, and agencies like Laura's, Kalihi Palama and IHS offer those support services that help the folks stay in the housing. Why this can be very attractive to landlords is that they are working with an agency. So if somebody who has got affordable housing comes and says to IHS or to some of the other agencies that are, working with this program, they will have a relationship, they will have guarantees with the agency that these individuals who are renting their apartments out will be paying the rent on the first of the month. If any damage is done to the property, the agency working with the individual will step in and do everything that we can to repair the damage, to ease the relations between the landlord and the tenant. You know, our tenants are former guests who are now in permanent supportive housing are doing very well, and to date we've had 100% success rate. So it's an extremely promising program, and we're finding that landlords who are working with us in this way are having such good results that they are saying, okay, fine, you know what, we're prepared to take on more of your clients and help them with the housing.
Yeah.
So
Well,
there are guarantees in place to help alleviate some of those concerns that people have.
So that's good to know. So someone like Mr. Souda might probably in the next month or two be in one of those Section 8 housing through your efforts, perhaps.
Except that Laura said that there's a 5-year waiting list.
Well, that's for Section 8.
Yeah,
and
yes,
for-
that's what he said. He was Section 8.
Yeah.
Yeah.
So if he's at the bottom of the list.
Precisely,
that's-
precisely.
And I've even heard that it can go up to 7 years.
Yeah. And that's different from the...
That's different from
yeah,
housing,
okay,
yes.
okay.
The permanent supportive housing is designed to help a very specific population of people who are homeless.
Okay.
So these are the chronically homeless, people who are struggling with severe mental illnesses as well as maybe a physical disability or a substance abuse problem.
Okay, that's good. But the other thing, though, is that with all your efforts, you know, you need more funding to be able to do more for more people because there are more homeless, right?
Well, and I think at the same time, instead of just doing the Band-Aid, we need to also incorporate prevention.
Yeah.
And I think that gets back
That's
to the
good.
poverty levels and looking at the poverty levels, the living wage, all of those things that can possibly prevent homelessness need to be part of this whole plan. Else we're just going to be band-aiding the problem and spending a lot of money.
Exactly.
Precisely.
Yeah.
As a matter of fact, at one time, the standard was that you pay 30% of your income towards housing. It's much, much higher than that now. I've seen the figure 50%. How in the world can people stay in a home when they pay 50% of, let's say, minimum wage? I believe the median income of the state of Hawaii, which is supposed to be very high and the envy of some other states, is something like $32,000 per year, which means
peanuts.
50% make more,
Yeah.
50% make less. But how in the world can you, for example, somebody was saying, I'm renting a home for $1,000.
Yeah, you got to
It's
pay.
ridiculous.
You got to
Well,
pay
you look-
taxes from the 32,000.
Precisely,
Yeah.
precisely.
And you also look at, like most of our folks, because of a severe mental illness or a disability of some sort, they receive Social Security. Social Security is $552. The median rent, I believe, at this point is $760 or
something.
something.
Yeah, exactly.
I mean, that would be 100% plus more.
Right,
There's
right.
not a
Yeah.
chance for them.
And the amount under SSI, supplemental security income, is much lower than if a person has a work history and is getting Social Security under the disability requirements.
Yeah. In fact, we have another interview about someone who was a drug addict and now is recovering, and we interviewed them at IHS as well, so we can watch that and show another face of homelessness. Yeah. So how long have you been at this shelter now?
For like a month and a half now.
Month and a half.
Yeah.
Before that, where were you?
We're living in Waianae,
Uh-huh.
Makaha,
Yeah,
the
where-
surf side.
Yeah, where in Waianae? You were at the house in Waianae?
I was in an apartment.
I see.
I was living with my brother.
Uh-huh. And so what happened that you had to come over here?
Well, we just left because my brother's place was too crowded and we needed a place for ourselves. And I was living on the street when I was pregnant with her. And I moved with him like a couple months.
And now what is the next step for you?
Well, we're just waiting for Section 8 to kick in. I've been saving up money in the kokua.
Now, how do you find living here at the IHS?
Well, I mean, it's better than living on the streets. Now that I have her, I can't think of myself anymore.
Well, this is another example. But before we do more discussion, I want to go to another, not interview, but actually we had a tour of your facilities, just to give people an idea that there are like hundreds in that area who are homeless, and you have nice facilities, but not enough for the job. So we need more of such resources as well. So whenever we're ready.
Hi, I'm Lisa Abbott. I'm the nurse practitioner at the Ka'aahi Street Clinic, which is part of Kalihi Palama Healthcare for the Homeless. We're going to start with a tour of the clinic here. This is our waiting room area, and this is our medical assistant, and she also does all the reception and helping the clients with their initial visit here. And we're going to walk over here. We got our famous water fountain that we get a lot of business from clients just needing water and wanting to come in. And we let them kind of take a break here if they're, tired and need to get out of the weather and stuff. So we're walking in the back right now of the clinic. This is our case manager and clinic coordinator. Our psychiatrist's office is right here. This is Dr. Wynn. This is our medication area. Some of the patients are not able to take their own medication, so we give them daily medication here, as well as we have a lot of samples that are donated to us that we give out to the patients who don't have insurance. And over on this side is one of our case managers, Marilyn Boutain. She does outreach as well as case management in the office. And that was also the child psychiatrist office, and we have a child psychiatrist 2 days a week. And we're also fortunate enough to have a dental clinic here. Kalihi Palama dental personnel come down at least 2 days a week to service our patients here. I also put up a bulletin board here with information for patients, opportunities to get into treatment, also opportunities to get into research programs, because a lot of times, there's osteoporosis research studies and things that patients can make money and, and help with research.
So I'm just wondering, how many of these clinics do you need to serve the thousands of homeless? I don't know how many thousand. Like once, over 10 years ago, I wrote an article on housing, and part of it is the problem of housing and homelessness. And at that time, the figure from the city was like 8,000 to 12,000 homeless. And recently I read that there must be about 12,000 homeless on Oahu, I suppose. So is that figure, how true is that figure? I mean, how is it reliable or is it not? And how many of these clinics do we need to service 6,000 homeless, for instance?
Well, on the first hand, the number of homeless, I think if you ask 10 different people, you'll get 10 different answers. And I don't think, although we have said for the last couple of years that we estimate that there's between 5,000 and 10,000 homeless throughout the state. We have no idea whether that's true or not. The counts that are done are mostly done according to the number of people that have received services. That means that all the folks that are in the caves and on the beaches that we can't find, they don't get counted. Mm-hmm. If they don't come in for services, they don't get counted. Some of the counts have gotten better in trying to find more people and make it a more accurate count, but it hasn't been as successful as we hoped it would be. I think more importantly than knowing the total number of homeless is knowing that there's wait lists. If there's a wait list, there's a need for services. IHS has a wait list for their family shelter. Our Shelter Plus Care program has a wait list. We can't provide services to everybody that walks in our doors on a daily basis. That alone should show that not only that the number of homeless is great, but that those who actually want services and are trying to get them are not getting them. Mm-hmm. In regards to the number of clinics that are needed, It's really hard to say. I think we need to open up new programs very cautiously because, again, if we're opening clinics that will provide Band-Aid services, we're not getting to the root of the issue. So we need to be very cognizant of the fact that we need to not put so much money into new programs, but possibly improve other programs. Our agency doesn't necessarily want to grow anymore. I don't think we've gotten to our expansion level that we're comfortable with. But there's some other really small programs that are wonderful programs, and we would really support them growing and getting new Shelter Plus Care programs. There's a lot of federal funding that we don't go for because we don't know that it's out there or we don't know what it would entail. We need to help the rest of the agencies get that specific funding so that they can improve their services and expand. You know, you look in the Waianae Coast, and you've got Waianae Coast Comprehensive Center. They're a wonderful health center, and you also have Waianae Community Outreach. They provide great services out on the beaches, and we need to improve those services.
Yeah, sure. Yeah, but what I meant is not only like you folks and your clinics, but you know, in terms of however many organizations there are. That was my question earlier. You know, in terms of what relations do you have with other organizations and so on. So the point is to service the homeless who are in need of services now, plus work on the long-term solution. I mean, that's what you would like to do as well, I suppose, don't you?
Yeah. Absolutely, that's what we're trying to do, and that's also what Partners in Care has been working towards, is between the agencies who are serving people who are homeless, let's look at who's doing what, and let the people who are already doing something specialize in that. For example, IHS does not, it's not designed to be everything to everybody. We have, you know, shelter, we've got case management services, we have, you know, the meal program. We're serving nearly 900 meals a day. We offer a range of services, but we also know that it is vital that we partner up with agencies who are doing specialized things like the healthcare, like the dental care, things like that. And we need to get the communication going so that funding that is out there, we can work with each other to identify what funding is appropriate and develop what's already in existence.
Before we go into, I have questions. I think we need to have some discussion about what really needs to be done beyond what AQ was suggesting and we have agreed to, and you mentioned, Laura, other things. But before that, let's just go to another interview with Rec, because he talks about working with other agencies as well. So we will watch that interview.
We work with many agencies such as substance abuse treatment facilities. We work with other shelters. We work with organizations that help us with employment training. We refer them to their program, and they assist us with getting the training and employment that our clients need. We also help them with housing, as far as referring them to appropriate housing facilities and agencies.
Yeah, so I mean, he's emphasizing this, underscoring the same kind of stuff we were mentioning before. AQ, okay, what do we need in terms of the vision to have everyone in a permanent situation that is not homeless?
Rick just mentioned making referrals of individuals and working with other agencies with regard to job training, or whether it's emotional support or that kind of counseling. It seems to me that somewhere down the line what we need is a one-stop facility, so that if I were a homeless person, I could go to your place and get that which is complete. I don't have to go to you, I don't have to go to him, I don't have to go to you. Perhaps there needs to be some discussion about that particular procedure which would make a person feel a lot more comfortable in coming to an agency. I'm sure there must have been some discussion of that. One of the other kinds of things I think we need to do is to take a look at the whole problem of mandatory sentencing. Now, mandatory sentencing is a way of getting people out of sight, out of mind, so that you don't worry about him because he has presumably the comfort of a prison cell. However, what you do is you separate an individual from his family for long periods of time, and when agencies sit down and talk about collaboration, they really need to look at the whole matter of mandatory sentencing as a kind of way in which you can alter your thinking about whether we are creating a homeless problem. To me, that is extremely important. One of the other kinds of things is working on that Perkins Act to see, in fact, if national legislation can be changed so that if people are in prisons, you use the maximum amount of dollars to retrain them, because we know the political economy is changing very, very rapidly, and you can't turn out 100 printers. I know that that a lot of prison labor is used to print stuff for government agencies. You've got to train them to do a heavy amount of technological work simply because that's the way the economy is moving. One of the other kinds of things, it seems to me, that has to be done is to work on legislation, and I mentioned this earlier, that would pay people an adequate wage. There's not much point in talking about we need more money to do this kind of case management services, to match up a person with this particular agency, that particular agency. If he's on a job, and 25% of the homeless do have jobs, if the amount of money they earn doesn't allow them to rent a home. One of the other kinds of things we should certainly take a look at is what's happening to public housing. If indeed the cutting out of the number of units as had occurred, not only at Kalakaua Housing with the renovation, but at Kalihi Valley Homes has occurred, then something is wrong. And clearly we need to do something about the fact that home ownership is not the end-all and the be-all to the homeless problems. In other words, think of it on a continuum.
Yeah. But this is part of the American dream.
Well, unfortunately, it seems to me it's a dream that is not capable of realization by most of the people in the United States.
Yeah, I'm just kidding. I just had to throw that one in.
I'm well aware of that, Brahim. So that much of what we do would call for our questioning whether the best thing to do under the circumstances is to keep homelessness at a minimum, which you had indicated, but which may not be entirely possible because of the nature of the ills with which our people are afflicted. In that particular case, clearly, we do everything that we can to keep those people from going over the hill, as it were, or to keep them living as long as possible, because we do know that homelessness takes a great toll, not only on the human mind, but the human heart and the human body. And it's our job to see whether or not we can't keep them going as long as possible.
Just to give us another idea as to what you folks are doing at IHS as well, there's an interview I did with Lisa, and she's telling us what she's doing and what her role is in terms of taking care of some of the homeless who need health care.
I'm basically doing the main portion of the medical care for the patients that come in. I'm an APRN with prescriptive authority. I have 2 physicians that are collaborating physicians on my license, one internal medicine physician and one pediatrician that I can call for a consultation. But basically I'm here, to see the medical needs of the patients, manage their care, and it's a combination of acute care as well as chronic disease management. It would be nice to have a registered nurse here to do some triage for me and do some other kinds of nursing case management that need to be done, which I often don't have time to do.
Yeah, okay, so that's an idea also about what you folks are doing. Do you folks, when you go to say to the legislature, to say, okay, we need more things, and I appreciate the idea that you don't want to grow. It's not good to grow too much. Some people might not like that, but anyway, it's not good. But do you folks, when you go to the legislature, do you try and talk about those kinds of issues that would make a permanent solution to the homeless? Do you folks do that also at the legislature?
I've done it.
Yeah, I know, but I'm talking about IHS and the healthcare.
I think it should be said that because we get state and federal monies, we're not able to lobby. And so that really hampers our ability to go down to the legislature and ask for things. But what we do is we go down and we educate them on what we are doing. And it's a fine line, and it's very difficult because we do want to say, this is what we need, this is how much money we need. But we're not able to do that.
But might there not be another idea? Might not there be another organization that you have relations with that can do this kind of educating and lobbying? Sorry.
Or even it would not fall within the purview of propagandizing, but you could say, look, we're spending all of this kind of money for healthcare. It makes a hell of a lot more sense for us to have a single-payer universal health plan. And get rid of I'll give you X number of dollars, I'll give you X number of dollars, I'll give her X number of dollars. Absolutely ridiculous, and it's an obscenity when we know that health care is needed.
Yeah, I have a question for you, AQ. Here we have the political economy, right? Tourism, and what goes with tourism? Real estate development. So you have tourism, real estate development paradigm of the economy. Is this responsible in any meaningful, significant way for homelessness and for not giving $20 an hour for someone on Maui?
Well,
or what?
Tourism has been touted as the economic salvation of the state of Hawaii. Certainly it has been touted since the demise of large agriculture, sugar and pineapple. But we all know that tourism has its ups and downs depending upon the development of the economy of the outside nations. Japan, for example, hasn't sent as many tourists as they had when the Japanese economy was flourishing. In the United States, the West Coast cities send more visitors than those who live farther towards the east. So much of what we are doing here in the state of Hawaii with regard to tourism isn't because we're selling ourselves well or not selling ourselves well. All of it depends on, do you have the money to travel or don't you have the money for travel? And we know that airlines, especially since 9/11, has kicked up its fares and people can't afford to travel anymore. It's ridiculous. One other thing is that in terms of the global economy, if I pay someone in China 40 cents an hour, why would I want to give somebody on Maui $22 an hour? It doesn't make sense for me as a capitalist to do so. I don't care if the guy on Maui pays his rent or lives under a tree. Who cares? We have someone who's a psychologist, a caller. She didn't want to, or he didn't want to be on the air. She sees lots of prisoners come out of prison and are unable to get jobs once employers find out they have a felony. I mean, that's fascinating. Prisoners get no support. Is there anything that can be done? Maybe something legally to force them to take them, for instance? I don't know, but anyone? You're a social worker.
But we've come across the fact that a criminal history negates a person's ability to get into a lot of public housing, which, as a community, I think it's really sad that when a person gets out of prison and they're supposedly rehabilitated, we actually support recidivism by not allowing them into all of the different parts of the community, including housing and employment.
Yeah.
So I think that's just a
That's
real
being
shame.
one's brother's or sister's keeper. You know, anyway.
As a matter of fact, that's reflective of the opinion that was given in this morning's paper where the woman said, I know what the problems are, I work in this area, but as soon as I know that somebody is on drugs, I won't rent him a house because he's undependable. It's the same philosophy holds true for a person who has been paroled, is looking for a job, and the employers don't trust him. I rather suspect that if they were to look at the total record as for the reason for conviction, they might find that they are having untoward fears about whether the man will or woman will or will not do well on a job.
Yeah, I think, you know, we can all do better and make sure that other people do better to help service the homeless and try to find a permanent solution for homelessness. But it seems to me we are up, going uphill. It's an uphill battle because it seems to me that the structural economy, the way the economy is structured, that is, does not allow us to find permanent solutions for homelessness in any uncomplicated way. So it's really an uphill battle, but it seems to me we have to deal with that and go from there. We have just a few minutes, and I'd like to show one more clip here, video clip. Has to do with servicing the homeless and in terms of whether they have insurance or not having insurance, and what do you do if they do or don't.
If they have insurance and we're not their primary care provider, they can change to us or they can go to their primary care provider. We generally cannot see Kaiser patients, and we try to get them to Kaiser. We put them in a cab to go to Kaiser. We give them bus passes to go to Kaiser. So we help them do that. We just don't say, oh, sorry, we can't see you. We really try to get them to their provider. But there's lots of people who are uninsured, and those definitely are our target population. It's just a bonus when they have MedQuest, and then we can get reimbursed for our supplies and services.
So the insured then don't have to be working necessarily, although a number of homeless
jobs.
Yeah,
they do. Sometimes they don't make enough money. They're so below the poverty level that they do qualify for Quest. Also, many of them are disabled, mentally ill, disabled with addictions. So, they are qualifying that way.
Okay, so we have just 1 minute left. Anything quick that we want to say? Anyone?
I just want to say that even though it is an uphill battle, and I think in a lot of ways it is, I think we have to have a positive attitude about
Absolutely.
it, because if we don't, then we'll never, ever solve any of these issues.
Well, thank you, Margot Shure, Laura Thielen, A.Q. McElrath. Thank you for coming, and thanks our viewers, and see you in February. We'll take a break in January, and happy holidays.